So moving next to the next syndrome or next baby issue that I'll be talking about. This is what is known as a neonatal abstinence syndrome. Okay, neonatal abstinence syndrome. So what is it? Okay, so this one is just a condition, all right, in newborns caused by withdrawal from drugs. So most especially, we are talking about opioids. All right, so the baby was exposed to these drugs in the womb. That's the mother was taking it, so the drug was passing through the placenta to the baby. But you gave birth to the baby now, you cut the placenta, and the baby is not taking those drugs. Do you understand? So some drugs, if you are taking them, if you want to come and leave them, there are some symptoms that usually come up, especially opioids. Okay, so it occurs when a baby is born to a mother that was using addictive substances. So the mother was not taking these drugs prescribed medically, but she was abusing them, So the baby's body got used to the drugs. So as you took the baby out during delivery, the baby is losing access to those substances, so they have to react, So symptoms that you might find within 1 to 3 days of birth, sometimes it might take 1 week after birth. Okay, so the baby is having high-pitched cries, or she's crying very well, or they are crying. It could be a baby, could be a girl, could be a boy. Tremors or jitteriness. Okay, vomiting and diarrhea, poor feeding and weight gain. All right, sleep disturbances, fever, sweating, rapid breathing. Seizures could also be coming up. All right, so substances that can cause this neonatal abstinence syndrome: opioids like what? Heroin, methadone, oxycodone, morphine. Other drugs like the mother was taking alcohol, nicotine, benzodiazepines, barbiturates, certain antidepressants. So diagnosis, of course, you want to now check if that blood is in the circulation of the baby or the mother. So blood test. Okay, then you evaluate the severity of the symptoms, that's the scoring system. All right, then you ask the mother, how far ma, have you been taking some 1 or 2 things? Okay, treatment depends on the severity of the symptoms. If it is mild, okay, just comfort care, swaddling, skin to skin contact, quiet environment. Sometimes you might need some of those medication in little amount, so you are withdrawing it slowly. As she's going, you are reducing the amount till the baby withdraws from it completely. Then if they need fluids, okay, intravenous fluids, high calorie formulation. All right, then hospital stay in neonatal intensive care unit. All right, that's it.